when they need to be bypass the ventricles, and you want to connect the pulmonary with the vena cava directly.
Okay.
And
Anyone else says the comment?
About education, you should tell only 4 things. Avoid dehydration. High altitude, there can be like hypo, what is this called? Due to the hypoxemia can leads to this polycythemia. And other thing advice is about the dental procedures, and you will involve the cardiologist for the follow-up, and you will involve the nutritionist for the high nutrition diet. Other things no need.
But only in complex or any congenital heart disease?
It depends which kind of congenital heart disease. Like if it is VSD, then I don't think so. You will say about the dehydration or high altitude. Then will be mostly you will keep the child
Dental
in
hygiene
follow-up.
and
Yeah, dental hygiene.
nutrition.
Keep the child for follow-up about the growth parameters, about the height, weight, and because there they can go in failure.
Dr. Rohel, gestation
Yes.
is in front of you. If he is having no scar mark, no murmur, so what would be your diagnosis?
If there is no scar mark and
No murmur.
no murmur at all, huh?
And loud S2.
Loud S2 is there. Age, same 20 months.
Same age, 20, 22 years like that.
But I should figure out. S2 is loud.
Failure. Isniminger.
So,
Reward.
Yes, Esserminger.
this,
Correct.
this can be Eisenmenger, but age is
Possible.
not compatible.
No. It's if not repair, he will go like this age. Esserminger.
20 months.
Yeah,
20 months is too early.
No, boss. We have seen a lot of patients. DNR.
because as loud, definitely there is pulmonary
Reversal
hypertension.
of the shunt in complex single ventricle.
Reversal of shunt is there. Reversal of shunt is.
So it's possible because early repair is advised in AVSD.
No, do you think
we have to save the lungs, no? We have to save the lungs. This is the early palliative care.
Yeah. This is a mandatory.
And S2 will show us like the failure, right?
Yes, sir. Yeah. This patient with the what other possibility with this patient? Clubbing, cyanosis, scar, and murmur. Have you got?
Clubbing, cyanosis,
murmur, scar. So what is other possibility?
Which scar?
Same you got, mediastinal scar. And another scar you can put.
Means differential diagnosis.
Differential, it can be murmur is where TOF, we should think of TOF also.
Yeah, this is the one of the possibility. TOF, number one. Number two, if no scar and no murmur, then SMU syndrome. And then, as you told, complex congenital heart disease. Did you comment on the dysmorphic feature of the baby?
No, Dr. Vakar told me in the initial you cannot see the face. That's why I didn't mention.
No, but you should have asked, is there any... No, but I know.
No, I said you the donut face because face was Down syndrome. That's why I don't want to show you. Maybe you will say the Down syndrome.
That's why this was the thing. This was the clue.
I thought, no.
This was the clue. He told you, if you see the face, you will understand Down syndrome. So that was the main theme to just don't show you face. So you should have asked for he has any dysmorphic feature?
No, definitely. So I will ask.
Yeah, that thing, I mean, it will be helpful for the thinking of what is a possible diagnosis. So usually the advice is given to parents is avoid the tattooing and piercing, good dental hygiene, and sometimes they are giving anticoagulant, especially with the valve, prosthetic valve. And this one prophylaxis is not recommended nowadays. In some cases, after operation, I think they are asking after any repair, they're asking 6 months to give. First 6 months. I forget that this one, there is a guideline from the NICE. They wrote, I forget the exactly, but we can discuss sometime further. So whenever you have the patient, you should have, you should keep in the mind this morphic feature should be you should note that this morphic feature. Otherwise, you did very good job. Yeah,
Dr. Irfan, what about
yes.
cavo-pulmonary shunt? What is this shunt? What area they are making the shunt?
Yeah, they are connecting this one vena cava to pulmonary, something like that. Yes. I don't remember exactly.
Yeah. Actually, yes, Dr. Bakar, they are connecting the superior vena cava to the pulmonary directly.
Yeah.
Okay. So what the procedure is called?
This is called what is called?
Fontan, modified Fontan, or can be
Glenn procedure.
Yeah, Glenn.
I forget the name. This one,
no, actually, both procedures.
For
both
reminder,
procedures
it is
are
for
almost.
Yeah, for sure. We are here to just recall our things.
It is also called hemifontaine.
Yeah, hemifontaine or Glenn procedure.
Hemifontaine.
And central shunt is the common terminology.
What?
Central shunt, that is common terminology. It can be used for anything, for Fontaine, for Glenn.
Means general term is central shunt.
Yep.
Yes.
Dr. Rohel, in advice in education, we also have to mention avoid tattoo piercing. Dental hygiene.
I told this thing.
Yeah.
I told this thing.
Yeah.
Tattooing and piercing in avoid.
Yes.
I mentioned all these things. And especially in the patient having the aortic regurg and this one, aortic stenosis, you should avoid the exercise.
Strenuous exercise.
Yep.
Avoid strenuous exercise.
So anyone else has the comment on this case? If no, we'll go for the communication. So I think Dr. Rasta, she's not here. The next is Dr. Irfan. So Dr. Irfan will be here. He's here. Let me.
Which one now? Huh?
Dr. Irfan.
49 page.
Page number 49, yes, okay. So just I'm reading this scenario. I think Dr. Neha is supposed to be role player, but she's not here. So if anyone else wants to be the role player, they are most welcome.
Which I don't know.
Scenario I'm reading now, then you decide. So the role is neonatal registrar, working in a busy tertiary unit, setting side room on the antenatal ward. You are talking to Melanie Anderson, a 25-year-old single mother. 6 weeks with her second child, she has been given antenatal steroids as she is in early labor. The obstetrician think it is very likely that she will deliver within the next 24 hours and have asked you to talk to her prior to the onset of established labor. So the task is, please talk to Melanie about preterm babies and discuss some of the difficulties and complications they are likely to encounter. Try to answer any other questions that she may have. So this is the scenario.
If no one is there, I can be the role player.
Okay, good. So yeah. Dr. Heren will be the role player.
Dr. Heren is better.
So
okay.
Let me set the time.
Should
we have
start?
Total 9 minutes, 6 minutes, just 1 minute, 1 second. Okay, you may start now.
Yes, good morning.
Who is giving the good morning?
Yeah, good morning. I'm Dr. Irfan, one of the baby doctor here.
Yes, doctor.
How are you today?
Yes, I am fine, doctor. But right now I am feeling quite stressful because of, I started the having pain and I have just 26 week of gestation, so I'm quite worried.
Yeah, it's only natural to feel like that as you have this condition. I totally understand. First of all, let me know how can I address you. It's
You
okay.
can,
Should I say you, Melanie?
yes, you can address me as a Melanie.
Well, Melanie, today I'm here to explain to you about your baby who is expected to born early. So, do you want anybody to join this meeting? Any your friend, any your family member?
No, I am a single mother. It's okay. You can talk to me.
Yeah. So far, have you any information early born babies? Do you heard about this thing
Yes, I
before?
heard. I had my cousin brother, his daughter born at 28 week, but now that
Yeah.
baby is doing good, and she is now uh, 5 kilo weight, and she's doing pretty good.
Well, that's great. I appreciate your memory. You recall everything. And here I'm going to discuss with you, as Melanie, you are going to deliver in within 24 hour, the next 24 hour. You know all about this thing.
Yes.
So here I am here to explain you and support you, and I will tell you all about how we handle the babies who born early.
Yes, doctor. I want to know that.
Yes, so you are most welcome. So as your baby would be born early, and he would be very small and tiny.
Okay.
Yeah, and when he will deliver, we will receive he will be received by a team of doctors, including baby doctors and doctor the from the this one gynae side, and also from the midwife also would be attending this delivery,
Okay.
and this would be that team of doctor with the good skills.
Yeah, I believe that is the normal protocol in all hospital, right? My concern,
That's
doctor,
great.
here, how
Yeah,
we would survive and will have a normal outcome. Will he or she will be okay in terms of his development?
I totally appreciate about your worries. I'm here to explain you. As I told you, the team of doctor will receive your baby, okay? And as required, we will support him, and the baby will be taken into the baby care unit, that is intensive care unit.
Yeah, I know that,
And
doctor.
you know,
That's why I choose this
yeah,
hospital, because I know that there are a team of doctors. They will support all these things. But my worry is, will my baby
yeah,
will stay alive and will have a normal development?
yeah. I appreciate your concern. First of all, let you know, we will support your baby, and it is quite early to say anything like that. Okay, and most of the baby at this age of pregnancy, and he will deliver as you will deliver, they do well with good care.
Okay.
If they don't face problem like, yeah, if they do not face problem like bleed into the brain, infection, okay, of the tummy, or heart problem,
Oh,
usually they do well.
so
Yeah,
doctor, will he need any breathing machine support, or any procedure to be done in my baby?
uh, yes,
Will
yes,
he
this
be
is
able
very
to?
good question, very good question. Initially, yeah, as I told, I'm going to explain you, these small tiny baby, they have problem of breathing and feeding, okay? and other problems like heart and tummy problems they may have. But initially, we need to support him with the breathing machine. And there's a one medicine because this baby has a stiff lungs,
Okay,
so
doctor.
they
So
need a breathing machine. Yeah.
yes,
Okay.
yes, doctor. So
Yeah.
is there any
So
way? Is there any way to prolong the delivery? I wish my baby to
6 minutes.
deliver normally.
6 minutes.
At least after 2 weeks or 3 weeks. Is there any way you can stop this labor process?
well, really, I appreciate your concern, and every effort has been tried to delay this delivery. But we are expecting, Melanie, you may deliver as you have a strong labor pain, and it is quite possible you may deliver in the next 24 hours. I'm sorry to say, from gynae side, what I got update, doctor for the gynae, and they told me you may deliver in next 24 hours.
So, doctor,
Yeah,
all babies who deliver at 26 week, they have all these problems like heart problem, brain problem, tummy problem.
yeah, very valid concern, and it's depend vary from baby to baby. Some baby may don't have this problem, like bleed in the brain and heart problem or tummy problem. Some baby don't have even.
Okay.
I'm clear to you.
Yes, yes, doctor. So,
Anything else you need to know?
You told me brain, the tummy problem. What kind of tummy problem may happen to my baby, doctor?
Yeah, usually this is a good question, and I will explain you. They can have infection of the gut, and that is
Okay.
usually a serious problem
Oh, I see. And
because
how you, if it happens, how you are going to manage that, doctor?
well, if it happens, we are managing, not giving feed, giving support with the antibiotics, okay, and these things we are doing this thing according to the patient. It vary from case to case. If it is serious problem, and we need to involve the surgical doctor also.
Oh, okay, okay.
Yeah. So anything else you need to know?
No, doctor. Thank you.
So 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 I will just let you know about bullets point of discussion that today we discussed that you are going to deliver a baby who would be born early, 26 weeks. Initially, he needs a support for the breathing, and it would be the his delivery would involve the team of doctor to give maximum support. Okay, and we will give full care and full support, and his stay would be longer in the neonatal unit. So we can
Time
have
is up,
another meet.
doctor.
Yeah, and we can have another meeting, and I will introduce a support group. Okay, thank you for your time out and your patience and your active participation in the discussion. Thanks a lot.
जरा बेटे क्या खाना है अभी आपको?
Thank you.
Yes,
White tea?
Dr. Hiren, your feedback, please.
Yes, yes. So, good attempt, Dr. Irfan. Your introduction was nice. You asked me like, how are you here? Because this mother is already in the labor pain. So
Yeah.
you can also say that I am here to, I know I am meeting you at the time where you are experiencing this labor pain.
Yeah, this thing I forget. Yeah, right.
Yeah, you have to put
I
little.
was having in the mind, but I just forget. Yeah.
Yeah, the
Yeah,
introduction
right.
in terms of the right context, so that you can say you are going through this pain. I'm very sorry that I'm meeting you in difficult or
And this time
painful
of
time
yeah,
which
yeah,
you are
this
going through.
difficult time.
But is that okay with you to talk to you about your baby's delivery plan. Then, okay. The other expectation from this was like you did not mention at all about epicure studies or about the local hospital data or the local national data about.
Well,
Um,
actually, you in the scenario, actually, it was a discussion about how you will care the premature baby, how you will handle
but
at
if
this
I ask you
gestation.
about the outcome, you are supposed to say about the epicure or the national data. This was my concern. If I don't raise
Okay,
concern, that's fine. You can
okay.
just talk to me about the normal these things.
Well, really, Dr. Heron, I just followed the this one, what is called Rebecca.
Mm-hmm.
She haven't mentioned all these things, so I was just going straight forward because usually epicure study we are mentioning when the extremely premature baby is there, 23 or 24 weeker. That time the questioning is like that. You are right. In your question, and the road player can ask any question. That time it will become more lengthy the things
Yeah, but
because
epicure is
that time
not related to only 23 or 24. It can be even if it
no,
is
no, no,
30.
you don't. No, no. Actually, the reference point of view I'm telling about you.
Yeah.
You are right. I should have mentioned this thing, epicure study. Right. Okay.
Yeah. Then about like IVH and whole like the possible complications which you mentioned about the brain problem, about a heart problem. In a
Yeah.
broad heading, you mentioned that was, I mean, nice. The other thing, you can reassure me like yes, there can be a heart problem, but we have a cardiologist, we have a heart doctor who can look after, who can advise us, and who can guide us. There can be very high chance of getting bug infection, but we have a team of infectious disease who can look after for this issue. You know,
Okay.
each problem you are mentioning and each problem also you are offering me a solution. So I'm getting reassured like, yes.
Okay. Good.
Then,
Yeah, that's good. Okay.
yeah.
Nice.
Then the other point about, uh, uh, yeah, about the surgery, the surgeon, I think if mother doesn't ask or role player doesn't ask, no need to go to in an extreme complication like necrotizing enterocolitis and surgical intervention and all.
No, but your concern was that what is the tummy infection and
Yeah,
what is the management. So I I briefly told that it we keep the baby NPO with the antibiotics, and then if it is severe, we need to involve other doctor also. So
yeah.
that was my concern. That was that thing I tried to explain to you.
Theoretically, you are right. I'm not saying that it is wrong. You will not be penalized for that. But if if I have not asked for surgical or operational things, then try to go to the avoid further escalation. This is
Okay.
my opinion.
Okay. Yeah.
Otherwise, it was good.
Thank you.
You're welcome.
Anyone else has the comment in this case?
Actually, these were the only concerns. Dr. Heron rightly said that the first thing you should ask is that right time to discuss
Yeah. Yeah.
about, because
This thing I
yeah, you
forget
can ask
to.
more thing if you
The
feel
starting
any.
point should be like that. Yeah.
Yeah,
Starting point.
you should ask this during our conversation. If you feel any time pain or discomfort, let me know so that I can call your doctor.
Yes, this is important.
So yeah, the other things when you raise these issues about different issues, can be heart or can be gut problems, bleeding in the brain, other things. So the same time you should say that I will reassure you that all these issues will be discussed with our best team as they present, and we will deal them with our best. Let's hope for the best. So this will be little bit reassurance you should give.
Yeah. Yeah. Right. Right. This is a learning point for me because I forget to mention
Yeah,
all these things.
one
Although
more
we are
thing,
doing like this.
Dr. Irfan.
Although
Yeah,
we are
one more.
doing like this.
Yeah,
Yes. Right.
one more thing you can add that as you feel well enough after delivery, you can visit your baby. This will be also reassuring point for
Yes,
him,
right.
for her.
Yeah, I was going to say this thing. You will be able to come. You are allowed to come and visit your baby
Yes. So
and
these
the
two,
staff in the baby unit. Yeah, yeah, right,
yeah, these 2 or 3 things only.
right, right,
Otherwise,
right.
that's okay.
Okay. Anyone else says the comment? Okay, so here, Dr. Irfan, please buy some sympathy and empathy from somewhere.
I'm okay.
I'm sorry, but please.
Yes,
We need
really,
some
yeah, yeah. This is
sympathy
very
from your side.
difficult job, really. And you have to be very covering person. Every time you should cover your patient concern. Right? You are right. I don't
Yeah,
know. I'm not on the track like before. I'm trying to be on the track. And don't inshallah, I have to practice
inshallah, by
more.
time, because you went, I have experience. I had experience before. It was scenario. I don't know what was scenario, but you are very well in that scenario. You had that sympathy and empathy you are aware of, but maybe because
Yeah,
out of practice we are.
yeah,
So
yeah.
this is
Right,
again.
right. No,
The
no.
other
Really, it was
thing,
a lot of lacking are there. Yeah, right. Lot of lacking.
other
Lots of
thing,
lacking.
gynaes, I think so many of them
Yeah, I
never
forget
gone.
the name
So
of
it could
doctor.
be
Doctor of
delivery
gynae doctor
doctor,
should
we
not
can
be.
say.
I forget the
Delivery
name
doctor, we
exactly.
can say.
Right,
Yes,
right.
yes. And infection of the gut, sometimes they won't understand because you may say there are some bugs may cause some problem in the food pipe. Not food pipe. What we say
Basically,
the gut.
doctor,
Soreness of the
gut,
gut.
gut. No, no. It's a
Soreness of the
infection
gut.
Gut.
no, no. Infection is a quite general term. I read from the NHS. This infection is a quite commonly used.
Okay, so it's okay.
This is not any jargon at all.
Okay.
It's
Okay.
better if you
And
use the
other
bug.
thing, yes.
Yeah.
It can be said
Yeah.
that in babies who born early, their organs are
Early.
not matured fully. So that's why they are expected to have more problems. Like their gut is not mature and it cannot tolerate full feeds, and we have
Feet.
to build up slowly. And there is a possibility that they may underwent some infection, but we have a team of doctor and we can take good care of the baby. Likewise for the lungs, likewise, as I mentioned, that the lungs will be not fully matured and the baby is expected to receive life-saving drug through the tube in the airway. And but the good
Actually,
thing is you had already received the steroid drugs, and that will help in the maturity of the lung.
measure of the lungs. You are right, Dr. Rifat. Actually, I was going to explain all these things that Dr. Heron told that I know all these things. It is a protocol. So I just missed all these things.
Yes, practically when
Because
we do
Yeah.
here, we forget all the things.
He told me I know
you
all these things.
you have
Yes.
to, Dr. Irfan.
No, no, actually, I was going to explain. Then when he told, I know each and everything.
So you will
So
So,
next
face
time,
these kind
Dr.
of things in
Irfan,
real
Dr.
exam.
Irfan, let me
Really.
yeah,
correct
yeah,
you. There were 3 times
yeah,
repeated word. There will be there are the doctors. They are going to support. They are going to deliver. So I told I know that all the doctors will be there. All the doctors are going to support the delivery, and that's why I choose this
yeah,
hospital.
yeah. That was by repetition. You are right, right. I, I realized this thing
Okay, Dr. Irfan,
because
one
the
more
thing.
question. Why are
Please.
babies born early? If role play asks, why are babies born early? Why my baby born early? How would you address this question?
Yeah, it's the better. Why my baby born early? Because you have early contractions, early labor,
Why?
and
Anyone?
it's vary from mother to mother. There is no exact
Most
some.
There are many reasons for having the early labor, but your delivery doctor would tell you best that what is the reason so that it can be avoided in next time if it is possible.
Yes, this will be the answer only.
So you
You will
will
not go for
put the ball in the
any.
others, doctor.
What is the most common reason?
Yeah, we can say we don't always know why baby is born early, but your delivery doctor will tell you better that why your baby is going to born. early,
Like the same
and they will also look for
answer.
the next pregnancy. If there is.
Yes, Dr. Vakar, you are rightly said. The same answer can be given when Dr. Hiran asked that, can you prolong my labor? So this is not our concern. We cannot do anything. So the same answer can be given.
Yeah.
No, no. Actually, thing is that they call you and they are expecting that baby will deliver early. It means all effort has been done. Every effort has been done, tried. If it is,
You
she is
can
not in
say the
labor.
delivery doctor is expecting that you are delivering next 24 hours, and after their examination,
Yeah, that is
after the
because she has
period,
the pain.
they are thinking that you are
She
going
is
to be
contracting.
delivered next
She is a
24 hours.
contraction. She is in contraction, meaning she may deliver. What we usually see. They usually tell us 6 hours ago, 8 hours ago, doctor, you may deliver. You have to come for the baby.
I think we are
So
going,
usually,
this, they will never ask in this kind of station. So most important information here is to know the epicure data to lead the scenario forward.
Yes.
Okay, here
What
in
is
this
what is
scenario, the
uh,
5
what is
things.
saying Epicure? What is study? What is saying about this 26?
26.
epicure saying I think 70-80% survival rate
Yeah,
for
70. I
26.
think I remember which one. 70. I
70.
think.
Usually,
Well, after the age
we
of
have to give
27, 90%, which I remember. After the age of 27 weeks, more than 90% survival.
because in the 26 it's a 70-80% survival rate,
But by
and then
26 weeks, 3 out of 4 babies are expected to survive. So by this way, we can see.
Yeah. Okay.
yep,
And the
3 out
5
of
things
6.
we should address in this, 5 things we should address. First of all, steroid injection, the benefits of the steroid injection. And if not given, we will tell them we will give you for the lung maturation and also to avoid the bleeding in the brain. The other thing we will tell her that about is Dr. Rafat said the organs are very mature. Is you know that baby is coming very early. So the organs which we should mention about the lungs, brain, and infection like septicemia and gut infection and nutrition. So these are the things we should address in a manner. If she's asking, it's okay. Otherwise, we should mention in a quick way, like in 1 or 2 minutes.
Okay.
So these organs can be involved. In long-term problems, if she's asking, like say problem in the hearing, problem in the understanding, the movement, or problem in the seeing, watching, in the eyes.
But
But
it's
in
vary from
every
patient to
scenario,
patient.
we should say.
We cannot say early
Yeah,
these
if
things.
they ask.
Hearing
True.
problem, ear problem, these are most common things. But we can say it is early to say these things. Can be normal, but they have the ROP.
Yeah,
Hearing
can be.
problem there
We will
also.
monitor. We will monitor all these
Yeah,
things.
all these
Close
things.
monitoring. Yeah.
I will,
Okay. So
I will
is
just tell you the
any
epicure data. 26 week is 78%.
26 weeks means 78%. Okay. 27 weeks, it is 90, more than 90%.
25 is 66%. 24,
Okay. 25 weeks.
22, 7%. 23 week, 22%. 24 week,
23 is how much?
23, 22%. So remember, like a
22.
table of 7. 22 week 7%, 23, 7 threes are 21, so it is 22. 24, 7 6 are 42. So 24 it is 42%, and 25 week 66%. 7 nines are 63, and 20,
And 26, 78.
yeah.
Okay. So shall we move for another scenario, and last communication scenario? So it is by Dr. Rashda, but she is not here, and I think she did not also tell us that she will not going to appear. Maybe some urgent problem. I don't know. So, anyways, anyone can do this. I will read the scenario. So you decide who will be the candidate because I'm the role player in this scenario. Okay, but I will reconnect the meeting because there are 5 minutes it will be disconnected.
Okay.